Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone.
About one of your TikToks discussing male and female reactions to GLP-1 medication. Are there differences between tirzepatide and semaglutide? And is there a trend among men and women in one more than the other?
So this is a very interesting question. There appear to be sex differences, like differences in how women versus men respond to GLP-1 medications. But most of this data is from studies looking at earlier GLP-1 medications that are not semaglutide and tirzepatide. So liraglutide, which is Saxenda, Victoza, dulaglutide, which is Trulicity, or exenatide, which was the OG GLP-1 that I've never seen someone on. I'll just quickly summarize what that data shows, and then we can talk about, emerging data on semaglutide and tirzepatide. So the early trials are done mostly in diabetic populations. And as I said, with the earlier generation GLP-1s. And what we see in general is that women tend to lose almost 2 times as much weight as men. But on the other side, the sort of other side of the coin is that they're twice as likely to encounter side effects, particularly of the GI variety that so many here will be familiar with, compared to men. And so why is that? Some people have wondered, are women just kind of on average starting out at a lower body weight than men in these research studies, and they're effectively getting a higher dose? It's certainly possible, but there's other study that has suggested that estrogen is playing a role. And this gets very interesting, but we know that when you lose estrogen in menopause, rates of insulin resistance go up and rates of diabetes go up. But we also know there's a Goldilocks thing going on where too much estrogen when you're pregnant, for example, might also dysregulate your insulin and your body's responsiveness to it. It seems that in studies that are not done in humans yet, this is all based on animal studies, that estrogen seems to somehow modulate the food reward aspect of food signaling, so of food seeking. So there are actually some early studies in animals where they're looking at co-administering GLP-1s with estrogen, and they show that that combo has a synergistic effect on activating this part of the brain called the supramammary nucleus, which controls food intake. It basically has a bigger depressing effect on food reward behavior. Think about food noise, right? We hear that term all the time on TikTok. Something about estrogen in combo with GLP-1 helps make the reduction of food noise more pronounced. And so scientists in this research community looking at GLP-1s have wondered if, aside from drug exposure and, your starting weight, if something related to estrogen is going on for this big difference we observe in GLP-1 effectiveness as well as GLP-1 adverse effect rates. So that's kind of what we know from the earlier studies, mostly in diabetics. Semaglutide and tirzepatide, we still haven't seen data that like, analyses of the big clinical trials, sub-analyses, I should say, that specifically focus on differences in men versus women. But I will say that unlike almost every research study and clinical trial that's done, women were overrepresented, were like generously represented in the big semaglutide and tirzepatide trials, around like 70% of enrolled participants. So it does give a little bit of a clue. So we'll see. We'll keep looking for future analyses that I'm sure, the team sponsored by Eli Lilly and Novo Nordisk are working on in the background.
Oh yeah, they'll put it out. That makes me think of, all those jokes about like women we're hangry. We go,
Yes.
we're grumpier when we're not fed or things like that. There's actually a lot of credence to it,
And I mean, it's been well described just looking at menstrual cycles, like, women, it's been shown that there's less food intake during the early part, the first half of the menstrual cycle when estrogen levels are lower, and then greater food intake when estrogen levels are higher. So that's further suggestion that estrogen is turning the dial up and down on how much reward we get out of food.
Yeah. All those dang hormones, right?
Hormones.
All right. So we heard some promising benefits about obesity treatment medications and the benefits that they create for heart conditions. Number one, can you expand on the medications and how they help? Additionally, I want to add this just personally because a lot of my friends will say, well, of course, it's going to do better for your heart because you're losing weight. However, I want to find, is there an actual correlation? Like say the study that came out that said Wegovy actually improved heart conditions. What are those clinical results besides the actual weight loss?
Yes. So great question. All of this exciting discussion around GLP-1s and improving heart health or preventing heart disease really comes from one big study, which was called the SELECT trial, which was presented and published at the end of 2023. And so in this study, they looked at semaglutide in patients, adults who had already had heart disease. And how did they define that? I mean, most of them, 2/3 of them had a history of heart attack, but they also included people who had strokes or who had blockages in their legs or had a heart stent or bypass surgery, something like that. But most of these were heart attack survivors. And they were like in their early 60s, BMI 33. Most were actually pre-diabetic. So it's not like this was a totally normal sample in terms of insulin resistance. And their cholesterol and blood pressure was pretty good at baseline, like pretty close to, because they were on statin medications and probably other medications to help control blood pressure, which is a major risk factor. And they randomized this big population of patients to get semaglutide at 2.4, the maximum dose, or placebo, fake medication. And then they followed them for only 40 months, as opposed to some of the other GLP-1 trials that look way out to like 72 months, okay? And in that short time frame, they saw a 20% reduction in cardiac events like heart attacks, strokes, and death from heart-related causes. They also saw fewer heart failure hospitalizations and events. So this really had a much larger than expected effect for a shorter than expected time frame, over which people lost not as much weight as we see in the obesity studies, like 10% weight loss on average. So we'll get to sort of your question about, is it the weight or is it some, I think we can even get to it now. Like, was this outcome because of weight loss? 10% is a lot, but like over just 40 months, it'd be hard to attribute that magnitude of a cardioprotective benefit to 10% weight loss. So what else could be going on? This is where we sort of draw on other research that's been done on the impact of GLP-1s on the cardiovascular system. So we know that it improves the function of that innermost lining, the endothelium, which is what dissected and caused the heart attack in Priscilla. It helps the endothelium and the blood vessels relax more, which helps lower blood pressure. It also helps our body get rid of salt. We know that salt isn't amazing for us. GLP-1s promote release of something called atrial natriuretic peptide, or ANP, which is sort of like your body's natural blood pressure medication. It makes you urinate out salt and, make the kidneys work better, and with that control your blood pressure better. But then And it does like a bunch of other things that are amazing for your heart health. It decreases inflammation. We know obesity has a big inflammatory component in its biology.
Yeah.
When you measure markers of inflammation, this was as much as like 39% in this big study that we're talking about. And then it also decreases cholesterol levels. So, your bad cholesterol, LDL, by 5 to 7%, triglycerides, those fatty acids, by up to 25%, depending on the medication. And so all of this together in aggregate is probably why we saw such a pronounced protective benefit over a shorter time frame for like a medium amount of weight loss in, when we think about all GLP-1s. So that's sort of what we're looking at. And tirzepatide, a similar study is underway. And hopefully we'll see those results soon, but TBD, we're all sort of waiting on the edge of our seats.
Yeah. That's good. Mounjaro, or tirzepatide, what I am on, has definitely helped reduce my cholesterol. Although I kind of sort of attribute it to, I didn't realize how many eggs I was consuming in a day just to get my protein in. And I had my blood taken and I was like, whoa. So it's egg whites for me.
Oh, egg whites. Gotta love them.
I was so glad to see that number go down, though. Woo.
Yes, it was so rewarding. It's really rewarding, isn't it?
Yeah.
Definitely. Let's chat about Retatrutide that was recently in clinical trials. It's a triple G agonist. Could you help describe what the medication does and also talk about the trials showing that it increased heart rate in some individuals? Should that be a concern for all?
Great question. So Retatrutide is something we're all very excited about. It is as you said, a triple agonist. So it stimulates the receptors. It basically recreates the effects of 3 hormones: GLP-1, which many are familiar with, GIP, which is also involved in the mechanism of tirzepatide. And how is that different? It has many of the same effects as GLP-1, but it also, we think, increases your body's like basal metabolic rate or energy expenditure. And then it also stimulates glucagon. It recreates the effect of glucagon, which is like the yang to the yin of insulin. It's like the foil hormone for insulin. And also, we think, reduces energy intake, like food intake, but increases energy expenditure, like how much your body is just burning on its own. So that was sort of that's the science behind why they created this triple agonist, as opposed to just sticking with new versions of GLP-1s only. And when they looked at a phase 2 study, so looking at safety in like 300 or so adults with obesity over 48 weeks, they saw that in the people who got to the highest dose, mean weight loss of 24%, which is so much more powerful with these medications. And also not even the triple agonists or double agonists like Mounjaro, Zepbound, but even in the older GLP-1s, we have seen an increase in the resting heart rate, but it's not very much. It's like 2-3 beats per minute on average when you look at all these research studies. And why is that so strange? Some people think that it's because of the promotion of these medications of insulin release. And insulin, when you release insulin, one of your body's responses is to, have a little bit of a heart rate surge. The other sort of effect downstream of that is that insulin increases the activation of your sympathetic nervous system, which we talked about before, sort of your fight or flight response. And that can cause some elevation in your heart rate. Most people don't feel this and might not be aware unless they're sort of tracking with some kind of watch or something like that. But of course, there are people out there who might have a heightened sensitivity to fluctuations in their heart rate. They might feel some palpitations. In general, like there's no major contraindication related to, like POTS or some kind of arrhythmia like atrial fibrillation that would make a doctor say, oh, we shouldn't start it because it might increase your heart rate by 2 points. If someone has a history, we might just monitor them or make sure that we check in about what their watch is showing and that kind of thing. So Retatrutide is an exciting new dimension in the frontier of obesity and heart health research. And we can't wait to see the next phase of study results.
That's going to be really cool. That's going to be great
Yes,
to see. I'm excited.
absolutely. I know.
So they think that'll be released in 2025?
Oh gosh, I don't know. I know it's underway. I don't know. I don't know when, but boy, we cannot wait.
I'm excited about it because I think I probably, I don't think I'll lose much more. I mean, 100 is way more than, it's like 2 or 3
Right.
times the amount that they thought that the study showed.
Yeah.
So I don't think I'm going to lose anymore. So I think unless I do what I've done in the past, which is just like dramatically, like, I mean, I don't even
limit
anyway, but you know what I mean? Like, I mean, unless I just diet my face off. Do you know what I'm
Right.
saying? Like,
You don't
I
wanna do
did
that.
all this to have a better quality of life, and I'm just not doing that.
Right. And it'll be great for patients to have, more options. And then, the more options there are, the more the accessibility problem will improve.
Yeah,
We
for
live in
sure.
a capitalist society. There'll be pressure on the price point. And, so whether it's Retatrutide, whether it's other GLP-1s, GIPs, or just GLP-1s, I mean, the more drugs that come to market, the better it'll be for patients.
I'm excited to see them come to market with things that aren't injectables.
Yes.
Because I think that if we can get people that are more afraid of needle, I feel like a lot of people get past that. But clearly that supply chain issue is one of the biggest reasons, right? That we have these shortages. And so I hope that there will be more options, like with oral medications,
Oral or just vials.
Yeah, whatever.
Amen.
Shoot in your eyes, whatever.
Men.
Spit on your tongue. Have a lozenge. Sorry.
It could be a lozenge.
Those are all real things on TikTok, by the way.
Oh my gosh! Wow.
Yeah. Oh yeah.
There's genetic therapy.
Oh, it's bad. Like,
really? Genetic therapy?
Yeah, there's some really interesting
tell us
genetic therapy. There's a company actually based in my lovely little home state, Massachusetts, called Fractal, and they've devised a way to essentially turn on GLP-1 through gene therapy that is delivered through an injection to the pancreas, which, you wouldn't do through the skin. You'd have like an endoscopy procedure to have that done. And they've only done this in mice, but so far when they look at mice on semaglutide versus, getting this gene therapy, more pronounced weight loss that lasts longer. And so I think they're starting, my sense is that they were going to start human trials this year. So that's another sort of direction that the research is going in.
Need to get them on the show.
Wow.
Yes. No, I know. Can you imagine having it turned on all the time?
Yes, please.
Without the fluctuations based on the drug level.
Yeah, because like that happens to me like towards, like the end. Like you guys I'm sure you can tell how my face looks today. It's because it's shot day. And so all the inflammation just goes from like here, like,
And then the fatigue and, the fluctuations in appetite suppression. Yeah.
True.
Sign me up for that trial.
Yeah. It's like I'm all in.
To go down through. It has to. So you have to like put to sleep to.
You would, yes. I mean, endoscopy. So if you've had it, you know what it's like. Yeah. But if you haven't, basically you'd be sedated the way like colonoscopy type of sedation, awake but not able. Not like so knocked out that you can't breathe. So, and then they put a cable down your throat into the esophagus and then into the stomach, and then from the stomach to the pancreas, and pop a little needle over to deliver the treatment. Yeah, I mean, I'm sure I can't imagine doing this in a mouse. Actually, I'm really impressed that they can do it in a mouse. But they had great data in mice
these days for surgeons. Seriously, I'm not being dramatic. I mean,
what did you say, Kim?
They have little robots to do surgeries.
I know.
That's what Dr. Rosen said. He goes, "I'm not like the kind of surgeon you think. I have little robot hands," and I go, "Poop, poop, poop, poop." It's like,
take the human out of it.
And geez, Louise.
That does not sound like a cheap procedure, though, if you think about it. But
right, and so there's a version of this kind of gene therapy out there for sickle cell disease now, and it's
that's amazing.
I think the price tag was over $1 million for a disease that affects a lot of people, from a low socioeconomic background. So of course that's going to be part of the discussion. We don't want obesity treatment to just be something reserved for the wealthy, right?
But then we could say we get all the shots back, right? That's been the whole thing. These celebrities are taking the shots. Well, they can go get the endoscopic injection,
that's
right?
true. That's true.
They can get the fancy
There's
one,
plenty
and
of
we'll
them.
have our little shots.
Right.
The people
There's
are
only so many Kardashians, though. That's the problem.
oh, yeah.
How many of them are there? I don't know.
They
but
keep
not-
making more. I don't know. It's a fascinating show. I can't take a train wreck. I can't stop watching it.
Oh my God, edit that out. I don't need Kim K coming after me.
Lydia!
Lydia.
No, Kris Jenner, leave us alone. Yeah.
Leave us alone. Leave us alone.
All right. Okay, we'll get back to business. So we got, many of our audience is women, and a lot of us are approaching menopause or perimenopause. Just some really good preventative, helpful things. Could you provide some things we can do to keep our hearts healthy approaching this time? And also, do you experience any cardiovascular changes during menopause as well?
Mm-hmm, absolutely. So there's a lot of important cardiovascular changes that happen during menopause. And I think in terms of keeping your heart healthy as you approach menopause or navigate menopause, it's like awareness of this is probably one of the most important things, because the average provider is not necessarily going to be sitting there like proactively educating you on this. We know that women of menopausal age and menopause related concerns are often neglected and under sort of discussed. So the changes that happen in menopause related to the heart, cholesterol levels go up. As we said earlier, insulin sensitivity goes down. Another way of saying that is insulin resistance goes up. Rates of type 2 diabetes increase. And then blood pressure goes up. And we talked before about BMI, obesity by BMI versus obesity by abdominal adiposity, like how much fatty tissue is around the abdomen. That, the distribution of fat around the abdomen really increases during menopause. And that's important because that's more likely to be infiltrating your organs, affecting their function, and leading to all of the, insulin resistance and metabolic problems that drive all of those bad things, whether they're heart disease risk factors or actual heart disease. So I think just having that awareness is important, because patients can drive the conversation too, right? Like the doctor, it doesn't have to be a doctor there with their like checklist, like, let's talk about your blood pressure, let's talk about your cholesterol. The reality is most doctors are overwhelmed and time crunched, and they forget to cover these bases. So if a patient who's perimenopausal is like worried about her heart health, then she can make sure to just say, hey, has my cholesterol been checked recently? I'm curious what it is. Or, hey, what was my blood pressure today, in case you didn't catch the number when the medical assistant was doing it? Or, hey, has my hemoglobin A1C been checked recently? Because, the guidelines are the guidelines, but they're not always implemented, and may have been 10 years before since you've had an A1C done. So I think the awareness, having a little bit of self-advocacy in the room and just like asking, making sure these things are being checked and watched are probably the biggest things. Yeah. Sometimes women in menopause, either because they're having symptoms like the hot flashes or, dryness, may look into hormonal replacement therapy. And there they may run into doctors saying, ooh, it might be bad for your heart. It might make you die. It might increase the clotting risk and all this stuff. And we do know that, estrogen increases the risk of clots. But a lot of this data on hormone replacement therapy in the menopausal woman is old, and subsequent analyses have identified some flaws in the sort of headline association that hormone replacement therapy increases cardiovascular risk. We have since learned that the timing of hormone replacement therapy may matter, and that the earlier you start it, like the more proactive you are, the less likely it may be to cause downstream effects on your heart and cardiac events. So that's sort of, again, just add that to the list of just self-advocacy questions you can ask. And if you feel like your primary care doctor, who frankly isn't trained to be like a menopause doctor, does, if you're getting the sense like, oh, maybe they don't know, or maybe they don't feel comfortable, it's fair to just ask for a referral to someone who may specialize in this. So awareness, proactive communication with doctors. And then I think like, to my fitties here and for all the other like aspiring, movement enthusiasts, whether it's a walk around the block or just like getting after the strength and resistance training, right? Exercise is one of the most powerful kind of like all around checks all the boxes treatments and preventative agents for your heart health for the perimenopausal woman. It helps maintain your weight. It's not a great weight loss vehicle, as so many know from struggling for years with weight loss, right? And trying everything. But it's a really, really effective weight maintenance tool or prevention of weight gain tool. So it's great for that. Lowers our blood pressure. It improves our insulin sensitivity with literally just one session of power walking. Your insulin sensitivity goes through the roof and it lasts for 48 hours, like no meds needed. And obviously it is a mood elevator, like so much of menopause can really crush you psychologically. Whether you're like worried that it's coming on or you're in it and you're dealing with all of the symptoms, or it's behind you and you feel like this sort of like life stage and chapter is closed and there can be a little bit of depression that comes with that, kind of like the cardio depression we were talking about before, aging, etc. So I think exercise and nothing serious, like not like my, I did a marathon, but it doesn't have to be like that. It's just walking, like literally walking 20 minutes a day. That's it.
What about like cleaning? It's my new thing, right? Like I hate to clean, but I
hate to clean too.
Right. And there's something I think because I like live on the internet with all these things like now, there's something very cathartic for me to just clean the crap out of things. Like it's ridiculous, but I hated it until now. Like I'm going to go in the kitchen. I'm going to sweep the mop floor. I'm going to do the dishes. Before I know it, like 20 minutes have gone by and I've just been moving like this.
And you've been moving, which is great. I mean, that counts. That counts. I mean, the other things I tell people, like I have this one patient, she's like in her 70s and she doesn't have equipment in the home. She's like not going to go and join, Planet Fitness or anything like that. But she does have a flight of stairs in her home. And she goes up and down, like outside of her normal like chores in the house. She'll just go up and down those stairs for 30 straight minutes, gets her heart rate up, and that's it. She hasn't lost time commuting anywhere, no special equipment, didn't cost her a dime. So I think there's a lot of creative ways to work it in. I recognize it's usually part of a lot of baggage and trauma, right? So each woman needs to come to this on her own terms and find a way to make it sustainable and joyful, and to sort of, I think that like being a little bit open and curious about things that maybe you don't feel as loaded as your history, what's been in your history. So some women I've talked to, like they were doing the gym twice a day, 60 minutes at a time, hitting the elliptical, and they like the elliptical causes PTSD, but like give them a strength workout and they're all about it, right? So I think every woman has to find the right thing for her, but as long as it's sort of hitting that level of like brisk walking or more, and you're doing 20 minutes a day of it, you are doing your cardiovascular system a huge favor as the hormone level tsunami takes over in that menopausal phase.
Awesome.
Anecdote. Yeah.
Before Kat goes, I got one question. We have had people on that you'll like it. We have had people on the show that are going through menopause or about gone through menopause, something like that, who take GLP-1s, and they were not, in appearance, obese. Okay, and I'm wondering because you mentioned that like insulin resistance, I think you said increased was the words that you used when you hit menopause, right?
Yes.
So does that mean that metabolically, like, I mean, it seems like sometimes like people may use this to get over that hump, to get back to where they wanted to be. It seems like some people may be maybe they've become like obese. But it's interesting because we've had other doctors on the show that one in particular, Dr. Ali, said there are people walking around everywhere right now who will never qualify for these medications, but because we know that so much of your weight is genetic, like, and they have obesity.
Right.
They have it, right? Like they have it. They're better at white knuckling. Their BMI doesn't meet what we think it should meet, but they'll never qualify.
Right.
And so that's why we have to stop like looking at people at
Yes.
deciding if they're worthy of these medications.
Yes, the BMI is it captures a lot, but not everything. And I think, this persona that you are sketching out, I mean, it is best described. I think the group that falls most into this category is like my people, right? Like, I'm half Chinese. Asians have a much higher rate of like metabolic dysregulation at a normal BMI. So they may have a totally normal BMI and look thin. They might even look skinny, like a lot of young Asian women tend to, but actually have like a high percentage of their body composition be adipose tissue with all the problems that come with that. And so unless they are actually type 2 diabetics, you're right, they're not going to meet clinical eligibility criteria and get covered by insurance for treatment with these medications, which is really tough. Being at the same pace with the awareness, understanding, and sort of progress, but slowly but surely, I think we will get there, and things will get better. And I think we see it excitingly in heart health, where there's an appetite to do studies that will change the narrative and change like what's getting covered for what. But I think we'll see it beyond heart disease too, some of these other areas that we've talked about.
That's great.
Go ahead, Kat. Sorry.
Okay. I was going to say before that about stairs. It's so funny because I have to add it. Betty White said that she did that. She didn't work out. She didn't walk, but she went up and down her stairs. Bless her.
Amazing.
I love Betty White.
If Betty White did it, sign me up.
So she said that's how she kept in shape. So,
Love it.
But we got a listener question for you from Jennifer Cloth. She is on TikTok. She asks, I've suffered from a low resting heart rate, low blood pressure, and throw PVCs. I'm going to have you explain that to us later. But it does mean extra beats. I realized that I haven't thrown PVCs in a long time. Could this be from taking a GLP-1? And also for the audience and the hosts, what is throwing PVCs, and what are some of the causes, if there are any?
Yes, great question. So PVC stands for premature ventricular contraction. It's an early beat that is coming from the workhorse part of the heart, the ventricle. And it is so common. I mean, I honestly think if everyone wore a monitor or an Apple Watch or something, like, it's very, very common. It can be from a number of reasons. Some of them are like scary. Some of them are totally benign. So, like some people, like during exercise recovery, it's very common to just throw PVCs as you're sort of, as your body is kind of just going from being really revved up to really relaxed. But it can also it can happen when your electrolytes are out of whack, for lack of a better term. If you have low potassium or low magnesium, this can happen. If you're dehydrated, if you're really like stressed or inflamed. And then, of course, if you've had a heart attack, you've had some kind of scar to your heart, whether it's a heart attack or some other issue, inflammation of the heart, that can serve as like a little nidus for extra beat, like the electrical wiring to get disrupted and for extra beats to come up. Most of the time, as I said, people aren't necessarily aware of them, but after a PVC, what happens is the heart, it's like a hiccup, and the heart often like takes a beat to reset and resume its natural metronome and natural rhythm. And when that pause happens, as it's sort of like resetting, that gives the heart more time to fill. And with the more time to fill with blood, the more blood it's going to be filled with. And so that next beat that comes after the hiccup or the post-PVC, the PVC, it tends to be more vigorous. So some people, if they feel anything, will feel that beat after the early beat. And so in the case of the listener who said she has a low resting heart rate, low blood pressure, and PVCs, but less PVCs while on GLP-1s, wasn't sure from the way the question was worded if the heart rate and blood pressure changes have come. They're low now that she's on a GLP-1. I think that, blood pressure, we know it can get lower on GLP-1s because, again, they relax the endothelium, that inner lining of your blood vessels, and they help us get rid of salt from our body and make our kidneys work better. Low resting heart rate, I mean, it depends on how low. But as we said before, usually it's increasing the resting heart rate a smidge. If someone had a reduction in their heart rate, I might wonder if it was because of improvement in inflammation, right? I mean, like when you're inflamed, your body's revved up and your heart rate might be going a little faster. Also, with more weight loss, your heart doesn't have to work as hard to circulate blood. So that's another reason that your heart rate might get lower without it being a problem. And then finally, again, with less inflammation and less just systemic stress to your whole body system, it might just create a more hospitable and favorable environment where you're not as likely to have those PVCs. So I wonder if the case of the listener actually pulls together a lot of what we've talked about on the show tonight about how these medications are working and the myriad ways that they actually benefit the heart and protect the heart. So kind of a cool little case study there. Awesome. But if anyone is worried about that, I would just say there are lots of ways to monitor yourself, and you can always just talk to your doctor about whether you can do a monitor of some kind.
Awesome.
Very cool.
I have the last question of the night, and it's the most important question.
Yes.
When you run, what podcast do you listen to?
Obviously the plus side.
You got a few hours, you might as well.
Heartbreak Hill.
Heartbreak
Hill, ladies. I wouldn't have been wouldn't have made it to the top without you all. So we could say that we all ran the Boston Marathon yesterday.
We could say that. I like that.
Was it yesterday on a Monday?
I ran it.
Marathon Monday. Marathon. It's a holiday here.
I ran with a doctor.
I do think, I'm going to just put it out there. I do think that a community athletic endeavor of some kind could be great. So fun. A 5K.
You too. You're in charge. Go make it.
I don't run anymore.
I guess number 2 and number 3.
A walk.
I'm a cyclist now. I do all the spin classes in the land, but
or you could do spin. You could rent out the.
You could get in a do a class with. We could do a whole plus
spin. That'd be some good
GLP-1 spinning. Oh my gosh, that would be amazing. That would be amazing.
Yeah, I will say this: when I got lower on my weight before, I started the Couch to 5K app, and it taught me to run, and I was able to run 5Ks. I planned myself a 5K every month, and it was you couldn't get me to run even if there was chocolate down the hallway before. But to go from not running to being able to run, there is that endorphin rush that it gives you.
Oh, I know. It's like a drug.
Like Kat, you do your spinning, and I think everybody just has to find that endorphin piece. And like Sabrina, I know you hate the stairs, but you're always on them, right? You do them. You do.
Love, hate.
Yeah.
That's amazing.
Dr. Lee, how long was your marathon, or how long was your run?
3 hours, 26 minutes, and 12 painful seconds at the end.
That is amazing.
But I got to see my little 4-year-old. He was there cheering me on with his little cowbell. And I mean, I think after the bombing the spirit of the city, it just feels like on the heels of the eclipse, it's like one of those moments where like humanity is coming together and we're all on the same side. And it just, you get a rush out of that. So it was fun.
When those things happen, it only lasts for like a few minutes. But when it does, like you got to drink it in, I think.
Oh yeah. No, it was great.
Then after that, humanity comes right back around.
It's waiting.
While we're all joined together. You know what I mean? Like during COVID, we would clap for the nurses and shit. You remember those days?
Yeah.
But then, like before we know, everybody's like trashing everybody again. So
talking about putting bleach in your veins.
Right. Yeah. Like, come on.
But no, I mean, I think it would be fun. I mean, like a community spin or a virtual walk or something, some kind of little challenge.
Virtual walk might be,
I could do something. Cool. I don't know how quick you could put it together, but you could do something the weekend that we're doing.
Kim's kettlebelling,
like
or clean your kitchen for your life.
Clean your kitchen for your life.
Listen, I get sweaty when I clean the whole house. I get sweaty and crummy.
I'm telling you, and then afterwards, and the whole time I'm doing it, I'm like, my brain will go look at your phone, go look at your phone. And I'll go, no, phone, I'm doing it. not doing it. There's
I
something
mean,
about it that really helps me. And then at the end, I'm like,
I know.
you
It's
know,
amazing. It's amazing.
yeah.
And like my family gets so mad at me. They say that I'm punish bustling them. Like I'm like punishing them by like cleaning up the mess that they made, you know? Like they made the mess and I come in like a tornado cleaning it.
Yeah.
But no, but it's for me. It's for me.
Yeah. Yeah. I mean, don't get me wrong. Like, I don't like to clean. Like just,
I love it.
like, ugh.
Yeah, I do it.
But I love the
Catharsis
way it
though.
I love the process. But I never was like that before. Everything is different now. The way that my brain works, everything is different now.
And
You
it's
know?
just physically, it's less to take on, right? I mean,
Yeah. And also it isn't
yeah.
like, it's not like miserable, right? It's,
Yeah.
you can, I think just, I've just sort of learned like there are some like physical tasks in this world to help you ground your body, right? And like I think a lot of that is like what Kat and what Sabrina will talk about around like exercise and stuff. Like my sister's really into yoga, and she's saying, she's like, I feel grounded. And with all the things that I do, where I'm always like up here and in the digital space, like it's good. It's just nice to have something.
Yeah.
I think it's like every human is different. Right? Like you said, everybody's got to come to their own thing. And like me, like first diet since I was 8, right? So like that's my life. So it's always been like quit the gym, start the gym, do the thing. Richard
There's a lot
Simmons.
of trauma
I've done all of it.
connected
I've done
to-
all of it. So I just had to find something that
That
I
felt
could do
good
that
on
would
your own
equal.
terms.
Yes.
On your own terms. Absolutely.
Yeah.
And there's a lot of trauma. People have a lot of trauma connected to exercise. Just
Yeah.
Oh,
I do.
Yeah.
a lot. I mean, we talked about dance before. My God. I mean, yeah, it's everyone has their own story. And so I think
For
it's totally unfair to be prescriptive or like,
Yeah.
go exercise as opposed to just learning who is
Yeah.
this person? What have they been through? What has caused trauma? What haven't they tried? But
Yeah.
might be curious about, right? And everyone's different. So
For sure. Exactly. I think, and that's why, like, I remember when I was trying to think, like, what is my mantra here, like on TikTok, right? It was sort of like, look, like I focus on nutrition. That's my first thing. Like, is there flexibility in that when I want to have like cake or something? Yeah. But it is for other people that are metabolically healthy. So why can't it be for me? Right.
right.
And then movement, right? Because I'm never going to be a diet and exercise person. I'm always going to be like, focus surrounding nutrition and move your body. You know what I mean? And then community.
Right.
So I think those are like how I've done what I've done, and if I do more in the future, but even just maintaining it, because like I don't think people realize when you're doing this, they're like, oh, lifestyle changes and trash like that. Like I don't mean like that. I mean like, how they mean it. How they say it. But while you're doing this, especially over a year and a half of me doing this now, my life changed. Right. So therefore my lifestyle changed. Right. And it is I think about it constantly, but not in a negative way. Like before I had thought about it in like a constant failure way. Right. Like no matter what I did, I'd constantly go gain it back and fail. And now it's just like, I'm just moving forward.
Yes.
It's just what my lifestyle looks like now. Right. And I think that I found a lot of people don't realize until they're there that they've changed their lifestyle, because most of us never got that far.
Right. No, but it kind of creates the cognitive space for you to be able to take that challenge on without that sense of guilt or failure or whatever, and I think sequencing is this all doesn't have to all change at once, right? Like you don't have to like transform every part of you and every potential part of your life in like the first 4 weeks of starting a GLP-1, right? You can just focus maybe on like letting your body get used to the medication and navigating some early side effects, and then maybe like getting into some kind of healthy routine or some kind of routine that works for you on, injection routine and tracking your weight. Like some people want to see it all the time and some people don't. And then, after weeks and months, like maybe you have the space in your heart, in your mind, in your spirit to take on some of the other things. But it's a process.
I totally agree. And we said that a lot in our lives, right? And where people like, I've only lost a pound. I've only lost 10 pounds in a month. I've only like my first month. And just stuff like that. And I'm like the managing expectations and the level of misunderstanding and misinformation, even just getting this from like a GP or wherever, is vast. And so like, I do want people, like, I think it's the first time ever in my life I've done it right. And what I mean by that is I didn't do those things you just mentioned. I didn't rush into it and go, I got to go to the gym. I got to buy the workout gear. Commitment. This is what commitment looks like. Right. And that's what I told myself, right, is this means that I am going to do it. No, it doesn't. So what I did is I just said, maybe a little less.
Right.
You know? That's it. And I just sort of like
small sustainable changes.
And then when I started to feel a little better, I was like, I'm gonna move a little more. You know what my goal is? My goal is to keep up with my laundry, to keep up with my dishes. That's it. Not let them pile up. That's it. That's my goal.
Good goal.
You know?
Yeah.
That's and that process allowed the lifestyle thing to happen. You know?
Right.
So everybody's different. Like some people, but I just didn't want a diet culture because that doesn't work for me.
Right. And for so many.
A million times. I mean, every year I'm at this, you know? So this is a whole new way of doing things. It can get exhausting, like to be like, but I feel like people that are trying to live a healthy lifestyle gets exhausted for them too.
Mm-hmm.
You know, like they feel that way too. Like, I mean, don't you sometimes be like, I don't want to run again? Like,
yeah, no, it's true.
You know?
It's true. There are days
no matter how much you like it, there are days you're like, you know, and I know.
How long of a break do you have to take after running your marathon, Dr. Lee?
I think
like
it'll
a
be
week?
like, I mean, this week I'll just be focusing on walking.
I just want to roll out of bed. That's it.
Right?
I know. There's this social media app called Strava for like, you know, runners and cyclists and stuff. And I joked today, I was like, I feel like I should post there that like I successfully got out of bed. Like that was the victory of the day. But I mean, this week it'll be very low key. And then over the coming weeks, some jogging, you know.
You could also just be like, and I was also on a podcast where I educated thousands.
Yes, I moved my mouth. I moved my mouth. Doesn't that count?
That was movement.
This was so fun. This was a joy.
Yeah.
Well, Dr. Lee, can I ask you a real quick question?
Of course.
So one of the things that surprised me when I started having the symptoms of what was going on is the pain was right here, more in the sternum. And we all watch TV shows and all of that. You see them go, oh, my arm. Usually have a heart attack. And that is something that my immediate thought was not heart attack.
Right. No, this is very important.
Can you describe the different ways these symptoms can manifest in people? So that way, if people are having those feelings, that they can seek the help that they need. Because like I said, not everybody lives across the street from a hospital. I was very lucky.
Yes. No, that's a great question. And it's one that like we try to bring up during Heart Awareness Month, which is February every year. All of the descriptions of heart attack symptoms, like an elephant sitting on my chest and some jaw pain or arm pain, these symptoms or this description emerges from studies done, you know, in shocker, Caucasian men. And so you know, everyone is stunned to learn that the people who are not Caucasian men don't necessarily experience heart attacks the exact same way. And so, you know, whether it's diabetics who may not experience anything at all, that's, you know, we call that a silent heart attack, or women or just people who have non-Caucasian backgrounds, they can have a whole, you know, spectrum of manifestations of what actually are heart attacks. And so, you know, in women, it could be what you experience, just some like central pain. It could be shortness of breath. You know, I don't say this to alarm anyone, but I think when it's sudden, when it's severe, and it's like very intense, you know, definitely pay attention. But yeah, shortness of breath, just fatigue, indigestion, you know, heartburn type of things. These are all very common fake outs or just like, you know, symptoms that people end up being dismissed when people go to seek medical attention, but that should be taken seriously if someone is set up with all the risk factors and they've experienced a sudden intense change. So, you know, it was so great that you went right across the street and you didn't try to wait it out. Because obviously the sooner that we say time is heart, you know, or time is brain if it's a stroke. And the sooner you get medical attention and restore the blood flow, the better one does in the long term.
Thank you for that.
Of course.
Such a good way to end it. Thank you so much. Great question.
Yes.
Yes, great
Awesome.
question. And
Hopefully
great,
this helps somebody, you know?
yes, no, great time with you guys. Such a fan of all the work you're doing. It's so important. And to be a small part of it, really,
Absolutely.
yeah, such an honor for me.
So I'm not sure when this will post, but if we do post this before May 17th, which we hope to, make sure everybody knows that Dr. Lee is coming to Atlanta and we'll be on a panel and we will stream a live episode of the podcast. And we are going to be talking. Keep doing it. Keep doing it.
It won't
I
do
still
it.
can't get it to do it.
I've done it like 4 or 5 times. I think it like only lets you do it within so many minutes, which is bananas. I'm putting it.
We're gonna give
We learned that if we make this
Lydia's gonna get.
it only loves me.
I think we just gave Lydia a seizure.
I know, right? For sure. Stop it. Love it.
Sorry, Lydia.
But we will
edit
be
out
there
the
and we will be streaming and we're getting this is going to be a very loud event.
I'm so excited.
We hope that if you are watching this and you haven't bought a ticket yet, go do that. Gosh. And let's change things. Let's get loud and change things. Okay?
Wear your 80s clothes.
Right. All right. We'll go ahead and say goodbye to our listening and viewing audience, and we will see you guys next week. Hasta la pasta.
Bye.
Bye.